You have a 50-year-old female with complaining of chest pain.
Scene safe BSI.
Your scene is safe.
Are there any environmental hazards?
No.
How many patients do I have?
You have one.
Do I need additional resources?
No.
What's the mechanism of injury or the nature of illness?
Chest pain.
Okay. And is there a need for extrication?
There is no need for extrication.
Is there a need for spinal immobilization?
There is no need for spinal mobilization.
At this time, I'm going to assess my general impression of the patient. The patient appears to be
Big sick.
big sick. So I'm going to also attempt to do my APU scale. Ma'am, hi. I'm Michelle, one of the EMTs that works here. Can I help you? Yes. Okay. So my patient is an A on the APU scale. She's alert. Is there any apparent life threats?
No.
No? Okay. And her chief complaint is chest pain, right?
Correct.
Okay. Is her airway patent?
Her airway is open and patent.
Okay. And her breathing is 12 to 20 unlabored?
That is correct.
Okay. I am going to go ahead and put the pulse oximeter on her finger. And according to the pulse oximeter, her O2 sat reading is 88%. At this
correct.
time, I am going to provide her with the non-rebreather at 15 liters of oxygen. So I'm going to put that on. I'm going to go ahead and move on to circulation. Is there any active bleeding?
No.
Okay, I'm going to assess for skin signs. And her skin signs are,
As you see.
so her skin sign is pink, or color is appropriate for patient's perfusion, dry, and warm. I'm going to go ahead and assess her pulse for 15 seconds. Okay, her pulse is 100 beats per minute. It's strong and regular. I'm going to make this patient a high priority patient based on the fact that her SpO2 is 88%. I'm going to go ahead and transport her immediately based on a GCS of 15. I'm going to go ahead and start my OPQRST. So, ma'am, can you tell me, is this pain that you're having, is it sudden onset, or have you been having it for a long time? So is it acute or chronic?
It's the first time.
It's the first time, so it's an acute pain. And can you point to it?
It's right here in the center.
Okay, it's right here in the center.
Mm-hmm.
Does it hurt more if I push?
No.
No? Okay. And is there anything that makes it better?
No.
No? Is there anything that makes it worse?
Getting up makes it worse.
Okay, so getting up makes it worse. Does this pain radiate anywhere else in your body?
Yeah, in my jaw and down my arm.
Okay. And how would you describe this pain?
About a 7.
Okay, it's a 7, and it radiates up your jaw and down your arm. And would you describe it as what? What kind of pain does it feel like?
Just a pressure in my
Pressure
chest.
pain? Mm-hmm. And how long have you had this pain?
About 45 minutes.
About 45 minutes. Do you have any allergies to medication?
Penicillin.
Okay. And are there any medications that you take?
Albuterol and Solopril.
Lisinopril?
Lisinopril.
Okay. Albuterol and lisinopril. Have you been diagnosed with other medical problems?
Hypertension and asthma.
Okay. And what was your last oral intake?
Cereal this morning.
Cereal this morning. And what were you doing when this pain started?
I was reading a book.
You were reading a book?
Yeah.
Okay. I'm going to go ahead and start my focused assessment. I am going to inspect the chest, looking for equal rise and fall. I'm going to go ahead and auscultate. Okay, her lung sounds appear to be clear. Any pain?
No.
No. Any pain?
No.
I'm going to go ahead and listen to her heart tones. Okay. Her heart rate is regular, no murmurs. Now I'm going to go ahead and collect my vital signs. Is it oxygen helping?
Yes.
Yes, okay, good. Okay. I have a blood pressure of 200 over 100. And I have a pulse of 100, strong and regular. And her breathing is between 12 and 20. Her SpO2 is currently at 98%. My field impression of this patient is that she's a high priority based on her chief complaint of chest pain and her O2 sat of 88% on room air. The interventions that I provided was non-rebreather, 15 liters, which seemed to help her pain. I'm also gonna go ahead and do my head to toe. I'm gonna palpate the head. Look in the ears. Go ahead and open your eyes. Look up. Conjunctiva, nice and pink. Looking at her nose, no nasal flaring. And we look at her lips. Her lips are a nice color, appropriate color for her. I'm gonna also look at the neck. I'm looking for any tracheal deviation. I am looking for JVD. I am looking for any stomas or any medical alert necklaces. Her chest is having equal rise and fall. Go ahead and reassess the lung sounds. And then go ahead and breathe normal. I'm listening for her heart. Okay, it's regular at 100. Do you have any pain
No.
here? No pain here?
Mm-mm.
No? Okay, go ahead and take a breath. Any pain?
No.
Okay, it's equal expansion. Any pain?
No.
And what about this? Okay, I don't see any blood in the perineum or any discharge. No edema, no swelling. I'm going to check for DP pulses. Okay, go ahead and wiggle your toes. Okay, push down, push up, and then check cap refill. Check your arms. Okay. Cap refill is less than 2 seconds. Wiggle your hands. And do it here. Sorry. This is still regular. Cap refill, go ahead and wiggle your hands. I can go ahead and provide a report now. We have arrived at the hospital, and I'm going to give a report to the receiving nurse. This is a 50-year-old female that called 911 complaining of chest pain. When I arrived on scene, her general impression of the patient was poor. She was alert on the AFPU scale. There was no apparent life threats. Her chief complaint was chest pain. Her airway was patent. Her breathing was even and labored at 12 to 20 breaths per minute. Upon placement of the pulse oximeter, the reading was 88% on room air, so I went ahead and provided 15 liters of non-rebreather, which seemed to improve her oxygen saturation to 98%. There was no active bleeding. Her skin signs were warm, dry, color was appropriate for good perfusion. There was also a regular pulse at 100 beats per minute, strong and regular. She was a high priority patient, so I transported her immediately based on a GCS of 15 as well. A pain assessment. Her pain is an acute onset, mid-sternal, radiates up her jaw to her shoulder. 7 out of 10. And she describes it as a pressure.
Yes.
And it started about 45 minutes ago. Has an allergy to penicillin. She takes lisinopril and albuterol for medications, history of hypertension and asthma. Her last oral intake was cereal this morning. And she was, I think, sitting down when the pain started. My assessment shows that there is no, her lung sounds are clear, her heart rate is regular at 100 beats per minute. There's no deformities, no contusions, no lacerations, there's no swelling. Her vital signs were 200 over 100. Her heart rate was 100. Her breathing was between 12 and 20. Regular, unlabored. Her SpO2, the last time I took her vitals, were 98% with a non-rebreather 15 liters. And her, I would reassess her with my primary, secondary vital signs and any interventions every 5 minutes. Do you have any questions? Otherwise, report is done.